Dr. Wood, author of the book Miracles Minutes, and the title of this video is Creating a Resilient Body and Solving Chronic Pain. There's something in us, that little inner child that wants to jump and run and do all the things we did as kids, and all of a sudden you get to be about 30 and 40 and 50 and you just can't do it anymore. And the statement is, I'm just getting older, Dr. Wood. Here's the problem I have with that statement. At what age do you get old? So I'm going to cover some things, and so how do I get into all this stuff? Number one, I'm a chiropractor of 21 years clinical experience. I want to live a life of the, have the best life I can possibly have, and no matter what age I am, I still want to be active with my children, my grandchildren, and maybe my great-grandchildren, if I get the benefit of living that long. So how do you create a resilient body, and how do you, and I'm going to cover some concepts from the brain and neuroscience to understand some fundamental principles, to look at some systems that you don't typically train in the gym that could be not functioning, that's causing you to have chronic pain. So part of my studies was because of I had some chronic pain from some football injuries. I had problems with balance. I had a problem with my hip. I had a problem with my knee, my neck, and my shoulders. I could still lift heavy at the gym, but my ability to do simple things of getting around the house was starting to be greatly affected. And it's very frustrating. You know, a lot of professional athletes, some football players that were once big and strong and now they can barely get out of a chair. Is there anything could be done for these guys? Or if you're not even a ball player and you have chronic pain, what can I do? So the first, it starts with understanding the brain and the nervous system. So pain lives in your brain, not in your body. If you cut your head off or you had brain damage, you wouldn't even know you had pain in a joint. So how does all this stuff sort of work? So first of all, in my book Miracles in Minutes, you have to go, well, what's the system wired for? It's wired to survive. And what do you need to survive? Oxygen, number one. You can only last a few minutes without it. Food, water, and shelter. And that's basically it. So if you got oxygen, you can get food, and you get water and shelter, you're good. Well, how does one go about getting food, water, and shelter? And it says you got to move. So if you were in the desert or in Alaska or out in the tundra, you're going to need to go from here to there. That means you have to stand up and walk or run to go get your food, water, and shelter. So that means, can you bend down? Can you touch your toes? Can you squat down? And if you start losing the basic movement patterns, your ability to get food, water, and shelter is going to be quite challenging. So how does the brain, what goes on in there that causes the balance, that orients the spine, that puts it into proper alignment so we can move? So there's a lot of things in rehabilitation of do these rotator cuff exercises, and it's a strengthening, but all the great rehab guys, particularly Gray Cook, who wrote the book Movement, developed the functional movement screen, realized that a lot of that stuff didn't work because that's not how the rotator cuff works. And that's not how the stabilizers that stabilize 24 individual segments and line it up. Babies weren't in the crib doing side planks. They rolled, they crawled, and they did these other things. So how does the brain orient? So first thing, it uses the eyes. As people get older, you see their eyes go and they look to the ground to orient their balance, to orient posture. Another system, I'm going to cover the eyes, think of it as one satellite. Another one is proprioception. All the joints, all the muscles, all the tissues, every artery, every cell is sending signals to the brain about how well it's functioning. The brain then reflexively does stuff back. Okay? I'm not going to get too complicated. I'm not going to get into what I was getting ready to talk about. So then the third way is through the vestibular system. Vestibular. So you have three circular canals in the ear, and one's upright and one's crosswise. X, see this X here, up and down, and then side to side. And that helps to orient the spine of straight up, and your shoulders, being even on both sides. So your shoulders are even and your hips are even. The vestibular system gets developed in early childhood. what do you see kids doing? Oh, I'm spinning around, I'm spinning around, I'm spinning around. And what happens is the fluid in your inner ear spins, and then the eye and the inner ear have to coordinate to line things up, to create balance, to track things. What happens is, as we get older, we don't have anything that stimulates spin or stimulates the vestibular system, and the way the brain works is use it or lose it. So your brain uses three things: your eyes, your inner ear, and your joint receptors to orient your spine in movement and athletics to reach, grab, and do things. Here's what happens is most people's vestibular system and their eyes and inner ear get uncoordinated. So you can go do as much yoga as you want. You can stretch till the cows come home and you'll get some temporary relief. But if you're lacking the vestibular system, if you start to lose balance, you have to tighten muscles. So you'll stay stuck in your problem. You'll stretch it out, but it comes back. You get massaged, it feels good, but it comes back. Or then you go get a hot pack and it relaxes the muscle, but the muscle tightens it back up. Because the brain needs to still orient you for balance. If one of the satellites, the vestibular system, is down, you only have two satellites left to work with, and the body has to compensate, and your body's under chronic stress. So your ability to touch your toes, your ability to move, it's not going to happen, because as you go to move and you're losing balance, the brain will throw the brakes on or tighten the muscle tissue so you don't fall over. So I was having a lot of chronic pain in my hip and my knee, and I was having a hard time moving my shoulders, and part of it is the vestibular system actually helps to hold your head in an upright position to orient it in space and time. And that would make sense, like if you know, a long time ago, if you had to hunt a deer, you'd have to keep your eyes on the target as your body's moving around it. So as your body's moving in space and time, your eyes need to stay fixated on your target. And what happens is some of the vestibular system sometimes gets off balance. So one of the things that I started doing with patients is have them start doing some vestibular drills, and the next thing you know, people had tight hamstrings. Their hamstring tightness just went away really quickly. People who couldn't touch their toes, we were doing all these stretches and the hamstring would get tight again. We do the stretch and they felt good, but the hamstring got tight again. I'm like, you know, is it something over time, or am I missing something? And when I brought in some of the vestibular drills or some eye tracking drills, boom, the hamstring tightness just cleaned right up and it was gone. People couldn't get their arm, you know, back behind their head, you know, trying to do all these different stretches and all these breathing techniques. And all of a sudden I brought in vestibular exercises, boom, they can move their arms again, and it cleaned up, and they got better and they got better and they got better, and it just started to go away. So what are some of the vestibular drills? So how does that work? And you have to do a little bit. So if you can think about this, if you haven't run in a long time and you try to take someone out of a hospital bed, so let's go run a marathon today, you can quickly reach into metabolic fatigue or neurological fatigue with the person. So in doing something good for them, you can screw them up. So you're better to err to do a little bit and to check results. The whole book, Miracles in Minutes, is a simple principle. Number one, baseline. In other words, you know, check a hard movement. Like I can only move my arm, like, okay, you can see how far I can move this arm in relationship to this one. Okay? So there's my baseline. So then what you would do, I'll show you how I do it in the office. So let's do a spinning drill. I got a spinning chair, and I'm going to spin my chair around. It's going to stimulate the endolymph in my ears. Stop, and my eyes feel like they're going like this. Okay? Look what my arm just did. How fast was that? Look how much better my range of motion is. So in just a few seconds, all of a sudden my arm, now I can get behind my head, where before my gap looked like this. This is not me faking anything. This is what my body would let me do. I could use my strength and try to use my muscles to crank up there, but when I used to do that, what happened was I actually slipped out my left shoulder and I caused a winging scapula, and I tore my bicep, and that hurt. I couldn't pick up a 5-pound dumbbell for 6 months, and I couldn't straighten out my elbow. And it took me a long time to figure it out. You know, I just tried to stretch it out, and that didn't work. But as I continued to read and study and try to learn from my mistakes, and I wanted to restore the health of my arm so I could do what I wanted to do, it led me to study vestibular exercises. So again, you want to play around with these things. The whole book, Miracles in Minutes, is set a baseline. What does it look like? You know, maybe you need to journal something, and you need to know if it's going to help you. Just because I showed you vestibular exercises doesn't mean it will help you. If that's not your problem, if you have an eye tracking problem instead, you got to do that one. If you have a breathing problem, you have dysfunctional breathing, then you have to do that. Or what most people find is it's not usually just one thing. It's a bunch of little things. And you start to clean up the bunch of little things, and you start to make progress. So the whole book, Miracles in Minutes, is I can get you out of pain in less than 2 minutes, usually 30 seconds, and with lasting results, and have turned people's lives around. If you need to, I can post some videos of some of the patients I've worked with who, one girl, Dawn, couldn't stand, couldn't walk, was throwing up in my office, and we did a couple simple little things, and next thing you know, she could sit on the toilet the next day by herself. So and a lot of people have been on chronic medication, and you're in chronic pain, got them out. I had some people who had chronic knee problems, keep getting your knee shot up with Synvisc and then doing this and that. Had them do some simple little exercises. Maybe I did some visual tracking. Maybe I had them work a new movement pattern. Maybe I had them work on their stabilizers. And some of these things you don't know what I'm talking about, but they're in the book Miracles in Minutes, of doing these simple little exercises to reboot your nervous system so that way it functions properly and you can be out of pain in less than 2 minutes. Dr. Wood, hope this helps you.